Imagine that your body is an incredible factory, full of machines working day and night to keep you healthy. The pancreas is one of those important machines, hidden behind the stomach, but which performs two fundamental tasks. It helps transform food into energy and keeps blood sugar under control as a regulator. It does this by producing enzymes for digestion and hormones such as insulin. Without the pancreas working properly, things start to go wrong. Now, imagine that, at some point, this machine starts to have problems. It could be a small blockage, something no one notices at first. This is pancreatic cancer, an insidious disease. It is difficult to detect at the beginning, because the symptoms can be confused with simple everyday things, such as stomach pain or tiredness. Therefore, many people only discover that they have pancreatic cancer when it is already at an advanced stage, making treatment much more complicated. Here comes the scary fact. Only 10% of people manage to survive for 5 years after being diagnosed. It's as if the pancreas is a silent machine, but when something goes wrong, the impact is enormous. But we're not just here to scare you. Knowledge is your best defense. Knowing how to identify warning signs is like having a warning light in the factory, indicating that something needs attention. Therefore, we created this video to explain in a simple and direct way the 7 main warning signs that may indicate a problem with the pancreas. For example, have you ever noticed if the color of your urine has changed to something darker, like tea or Coca-Cola? Or if your stool looks oily and floats in the water? These could be signs that something is not right. And there's more: loss of appetite, itchy skin, back pain, or even unexplained weight loss. These symptoms may seem small, but when added together, they can be important clues to detecting pancreatic cancer in time to treat it. What we want is for you, your family and friends to stay alert. Knowing your body and paying attention to its signals is like having a line of defense. Don't underestimate changes in your body, and never stop seeing a doctor if you notice something different. Let's learn more about these signs together and how they can save lives. Sign 1. Dark urine. Have you ever noticed that sometimes it gets darker, like tea or Coca-Cola? This can happen for a variety of reasons, such as when you don't drink enough water or take certain medications. But there is another reason that is important to know. It could be a sign that something is not right with your pancreas. The pancreas is an organ that works together with the liver and gallbladder to help with digestion. They use pipes, called ducts, to transport bile and other substances. But if the pancreas isn't working properly because of a serious problem, such as cancer, these ducts can become blocked. When this happens, a substance called bilirubin, which should be eliminated, ends up accumulating in the blood. This bilirubin is like a yellow dye, and when there is too much of it in the body, it can make the pee a very dark color. This even has a complicated name, coluria, but you just need to remember to pay attention to the color of your pee. If this happens once in a while, it may not be anything serious. But if you notice that it is happening frequently and you still experience other symptoms, such as pain or tiredness, it is a sign that you need to talk to a doctor. The sooner you find out what's going on, the faster you can take care of the problem. Sign 2. Oily stools that float. The poop. Have you noticed if he looks different? One sign that may indicate a problem with the pancreas is when the stool becomes oily, appearing greasy, and floats in the toilet bowl. It seems strange, right? But this happens for a reason. The pancreas has a super important function. It produces enzymes that help break down the food you eat, especially fats. When the pancreas isn't working as it should, because of a serious problem like cancer, it may not produce enough of these enzymes. So, what happens? The body cannot digest fat properly. This undigested fat ends up going away with the poop, leaving it with a shiny, somewhat oily appearance, and causing it to float, because fat is lighter than water. Additionally, the smell may become stronger and more unpleasant than usual. If this happens every now and then, it might just be something you ate. But if you notice that it's been like this for several days in a row, it's important to see a doctor. It's always better to find out what's going on early so you can take good care of your health. Sign 3. Jaundice. Let's talk about something that the body can show and that we shouldn't ignore: skin and eye color. Have you noticed if they turned a little yellow? This has a complicated name, jaundice, but the reason behind it is actually simple to understand. Inside your body, there is a substance called bilirubin, which is kind of like a yellow pigment. It appears when the body recycles red blood cells, those cells that carry oxygen. Normally, the liver and pancreas help to send this bilirubin away from the body, as if it were recycling garbage. But if the pancreas isn't working well because of something serious, like cancer, it can block the pathways through which bilirubin needs to pass. Then, this substance accumulates in the blood. And what happens? It begins to turn the skin and the whites of the eyes a yellowish color. This is a sign that we can see, and that could be one of the first warnings that something is not right in the pancreas. If you or someone else notices this, it is very important to see a doctor. Finding out early makes all the difference in taking care of your health. Before continuing with the signals, have you checked if you are subscribed to the channel? If not, take the opportunity to click the subscribe button and activate the bell. Sign 4. Itchy skin. You know that urge to scratch that doesn't go away, even with cream or a shower. Well, this could be more than just dry skin. When the pancreas is not working properly due to something serious, such as cancer, bilirubin can accumulate in the blood. Do you remember her? It's that yellow substance that, in excess, can turn your skin and eyes yellow. Furthermore, it can also irritate the skin and cause itching. This itching may start mildly, as if it were just a nuisance. But, over time, it can become so strong that it even interferes with sleep or daily tasks. Sometimes the itching appears more on the hands and feet, but it can appear anywhere on the body. If this happens to you and doesn't improve with regular moisturizers or creams, it's a sign that the body is trying to tell you something important. Don't ignore it. See a doctor to understand what is happening. After all, taking care of your skin can mean taking care of everything inside too. Sign 5. Blood clots. Let's imagine that blood is like a river flowing through your body. It takes everything you need to function well, like oxygen and nutrients. But sometimes, this river can get a traffic jam called a blood clot. Pancreatic cancer can make the blood more likely to form these knots or clots, which can appear in places like the legs or lungs. In the legs, this can cause pain, swelling, and even redness, as if the area is injured. In the lungs, it can be even more serious, with symptoms such as chest pain, difficulty breathing, and even coughing up blood. If something like this happens, it's an emergency signal. It is important to see a doctor as soon as possible. Sign 6. Swollen gallbladder. Imagine that your gallbladder is like a small pocket that holds bile, a type of liquid that helps the body digest food. It stays there, close to the liver and pancreas, and normally does its job without causing problems. But if something blocks the paths through which bile should pass, such as pancreatic cancer, this pocket can begin to swell, like an overfilled balloon. When this happens, you may feel a dull or even severe pain in the upper part of your belly, towards the right side. Sometimes the pain even travels to the back or right shoulder, as if it were an echo. Furthermore, this problem may come with other signs, such as nausea, vomiting, or even fever. If you notice something like this, don't ignore it. A doctor can use machines like ultrasound, which work like a special camera, to take a look inside your body and find out what's going on. The sooner you resolve the problem, the better for your health. Sign 7. Sudden, unintentional weight loss. Let's talk about something that may seem good at first glance, but is a warning sign: losing weight without even trying. Imagine eating normally and suddenly realizing that your clothes are loose and the scale is showing smaller and smaller numbers. This can happen when the pancreas, the organ that helps digest food, is not working well. Why? First, your body may have difficulty absorbing nutrients from food. Second, pancreatic cancer, oddly enough, steals a lot of energy from your body to grow and spread. It's as if it speeds up calorie burning without you realizing it. If this weight loss is accompanied by other symptoms, such as tiredness or stomach pain, don't ignore it. Talk to a doctor. Finding out what's going on early can make all the difference. To conclude, pancreatic cancer is a very serious disease and can appear with various signs in our body. Knowing how to identify these signs and see a doctor early on can greatly increase the chances of successful treatment. The 7 signs we show here are important to keep an eye on. The doctor can do some tests, such as blood or imaging, to understand what is happening and help you with the treatment. The earlier cancer is discovered, the easier it will be to treat, so it is very important to take care of your health and pay attention to these signs. Thanks for watching. And don't forget to share this information with your friends and family so that more people can take care of themselves too.